Hi guys, my name is Shania Marler and today I'll be presenting a speech regarding Ebola. What is Ebola? According to the CDC website, Ebola is known as a hemorrhagic fever and is a rare deadly disease caused by an infection with one of the Ebola virus strains. Ebola can cause disease in human and non-human primates such as gorillas, monkeys, and chimpanzees. How is Ebola caused? The causes of Ebola it is caused by an infection with a virus of the family of Filovidae. Symptoms of Ebola include nausea and vomiting, diarrhea which may be bloody, red eyes, raised rash, chest pain and cough, severe weight loss, stomach pain, bleeding usually from the eyes, and bruising. Treatment includes balancing electrolytes and bodily salts, maintaining oxygen status and blood pressure, treating other infections if they occur along the way, and monitoring the patient for other specific signs. Note, these will not cure Ebola, but will help increase the chance for survival. Ebola is not spread through casual contact, but through air, water, or food-grown products in the U.S. Ebola is spread directly through bodily fluid contact of a person who has been contaminated with the Ebola virus. Other objects that have been contaminated, such as needles or medical equipment, or infected animals by contact with the blood or infected meat. Symptoms can appear as early as 2 days to even 21 days of the Ebola virus. After 21 days, if it hasn't had any symptoms of Ebola, they will not become infected. Still, the chances you will be exposed to Ebola in the United States are very low because of the tight infection control practices of the public health care workers here. Facts about Ebola as of March 16, 2015. The largest outbreak of Ebola was recorded in West Africa. The first Ebola case diagnosed in the United States was on September 30, 2014 in Dallas, Texas. Ebola is most widespread in West Africa. There are travel warnings in Guinea, Liberia, and Sierra Leone. Ebola is an RNA virus. It is unlikely that Ebola will infect your dogs or cats, so you don't have to worry about your household pets. Early symptoms of Ebola are other viral infections such as the common cold, flu, other things like that. Bleeding is common in the later stages of Ebola. Ebola is often fatal. Out of the 24,282 cases, 9,976 were reported deaths as of March 11, 2015. New Ebola medications are currently in development, but they are still having to test them on other things before we can use them as our primary treatment for the Ebola virus. There is no vaccine to prevent Ebola. So if somebody does get contracted with Ebola, the only thing they can do is help maintain the oxygen status, blood pressure, other things like that, treat other infections if they occur as stated earlier, or monitor the patient for other specific signs of the Ebola virus to increase their chances of survival. Again, the Ebola virus is not spread through air, water, food, but you can only contract the virus if you come in contact with somebody who is contaminated with the Ebola virus. Ebola is not at risk to the general public in the United States. You are not at risk for the infection unless you have direct contact with blood or bodily fluids of somebody who has been contaminated with the Ebola virus. Thank you for watching my speech regarding Ebola.